my name's Ashley. I'm a registered nurse certified diabetes educator. So I'm going to be doing the diabetes lecture for today. Okay? So just to let everyone know, we do have people in class, and then there's also people on Zoom. So I'm going to do my best trying to look at everybody. But if I'm kind of looking down or not at you, I'm not trying to ignore you. I'm just trying to make sure everyone is seeing me and seeing the lecture. Okay. For those of you on Zoom, if you do have any questions, I'm going to leave time at the end that you can ask them either in the chat, or if you want to unmute yourself, you can do that as well. So before we get started, I'm just going to go over what happens when we eat. So what happens to our blood sugar levels when we eat food? So our body uses a form of sugar called glucose for fuel. So all the cells in our body, they need glucose to be used for energy. Particularly our brain. Our brain uses a lot of glucose for energy. So when we eat, our body converts that to glucose. This starts to increase our blood sugar level. When our blood sugar levels start to increase, a signal gets sent to an organ called the pancreas, which produces a hormone called insulin. And what insulin does is it acts like a key, and it takes that glucose out of the bloodstream, opens our cells up, and allows that glucose to get into our cells so we can use it for energy. So this happens when we eat food. So what is diabetes? So diabetes is a disease in which your body, it's not making enough of that insulin. So not enough insulin to move that sugar out of your bloodstream and into the cells, and or the cells in your body, they're not accepting that insulin to open them up to allow that sugar to get in. So this results in a buildup of sugar in our bloodstream. So sometimes people say that they might feel more tired than they normally are. They might be going to the bathroom more frequently, feeling thirsty. These can be signs of high blood sugar level. Not everyone experiences symptoms when it comes to diabetes. So sometimes people can have their blood sugar levels running higher and they don't even know. So I always recommend it's always a good idea to follow up with your doctor for your regular checkups, your regular blood work, so that you can keep monitoring and making sure that blood sugar levels aren't higher than where they should be. Reason why it's not good to have all this sugar in our blood. So one, it makes us can feel tired and sluggish. Also, over time, high blood sugar levels can start to damage the organs in our body. So eyes, our kidneys, our nerves, and our heart. So what leads to hyperglycemia or high blood sugar level? So multiple things happen in our body that can lead to this high blood sugar level. So as I mentioned, our pancreas is not able to keep up and it's not producing as much insulin as we need it. Our cells in our body aren't using the insulin like it should be. Our liver can start to produce extra sugar when we don't need it to. We also have hormones in our stomach that help with blood sugar regulation. They're not signaling properly. So it's a lot of different things that are not signaling properly that can lead to this buildup of sugar in the blood. And then that's where we get that diagnosis of diabetes. So how do we diagnose diabetes? So typically, your doctor would get you to do a couple of tests to determine a diagnosis of diabetes. So one of these tests is a fasting blood sugar test. So you've had nothing to eat for about 8 to 10 hours. You go in, they'll draw your blood. If it comes back, as you can see in this chart, in that 6.1 to 6.9 range, we call that impaired fasting glucose. So what that means is your body's not really able to keep your blood sugars low in that fasting state. So that's more in that, that can be in that pre-diabetes range. So it's not a diagnosis of diabetes, but it's in a range where you're more at risk for developing diabetes. If your blood sugar for that fasting was to come back at 7 or above, that could be a diagnosis of diabetes. Another test they might get you to do is called a 2-hour glucose challenge test. So that's where you'll go in, you fast, and then they take your blood, and then they give you this really sugary drink to drink. And then 2 hours later, they'll check your blood and they'll see where that is. So that test, it's measuring how well your body is able to handle a really high load of sugar. So it's about 75 grams of sugar in that one drink. So quite a lot of sugar. So if those results come back in that 7.8 to 11 range, again, not in that diabetes range, but in that pre-diabetes range. So more at risk of developing diabetes. Anything 11.1 and above, that would be in that diabetes. Another test they get you to do is called your A1C. So what that one's looking at is your past 3 months of where your blood sugar levels have been. It is given in a percentage. So in anywhere from 6 to 6.4%, that's it again in that pre-diabetes range, risk of developing diabetes. And then anything 6.5 and above, that would be where that diagnosis of diabetes. Another test that they might get you to do, but it's not as really commonly done, it's just a random blood sugar. So it doesn't really matter when you've last had anything to eat. Anything 11 or above, that's where we would look at is that in that diabetes range. So they wouldn't base your diagnosis off of just one result coming back. We'd have a couple, they typically get you to do two of those tests. And then depending on the result, that's where that diagnosis is. So this chart here, it just shows the natural history of type 2 diabetes. So as I mentioned, blood sugar levels can be high and people might not even realize that the blood sugar levels are high. They're not experiencing any symptoms related to diabetes. Okay? So if we look at this chart here, you can be in that pre-diabetes range for years and not really know it. The concern with that is it can start to have some damage to some of our organs because blood sugar levels are higher than where they should be. So as I mentioned, always a good idea to get your regular blood work done so we can catch things quickly and work on ways to prevent things from progressing. So diabetes is a large and growing epidemic. So it's very common for, you might have a family member, friend, someone you know might have a diagnosis of diabetes. You yourself might have a diagnosis of diabetes. Very common, and it's expected to continue to keep growing. About 1 in 11 adults globally have a diagnosis of diabetes. So quite common. So as I mentioned, we get concerned about high blood sugar levels, particularly if they're consistently high, because it can start to lead to complications related to diabetes. So we have our macrovascular complications. So macro meaning big, vascular meaning our blood vessels. So the large blood vessels can start to have some damage to them. So in our brain, that can lead to increased risk of strokes. Our heart can affect the blood vessels in our heart. So want to make sure that blood sugars are under control. Also blood pressure as well. We know that if our blood pressure is high as well, it can also put some damage on our heart. In our extremities, so particularly our feet, something called peripheral vascular disease. So it can start to impact the large blood vessels in our feet. Okay, so this reduces blood flow. So sometimes people might complain that If you were to get a cut, it's not healing properly. Your feet, your legs are cold. Maybe they're turning a different color than normal. So those could be signs that there's not great blood getting to the feet. Microvascular complications. So those are the small blood vessels in our body. So our eyes have very small blood vessels in them. Okay, so for people with a diagnosis of diabetes, it is recommended that once a year you're getting your eyes checked. This is covered by OHIP. So you let your eye doctor know, I do have a diagnosis of diabetes. They're going to take a look at the backs of your eyes. So they're going to take a look at the small blood vessels in the backs of your eyes to make sure they're not leaking any fluid. So with the eyes, so retinopathy, that's where those blood vessels are leaking fluid. More at risk for cataracts and then glaucoma as well. Our kidneys, so our kidneys also have very small, tiny blood vessels in them. So high blood sugars can start to affect those blood vessels. Again, so can high blood pressure. High blood pressure, high blood sugar, want to make sure we're keeping those lower. Once a year, if you do have a diagnosis of diabetes, your doctor should be getting you to do a urine test. So what they're checking to make sure is you're not spilling too much protein into that urine. And then neuropathy, so high blood sugars can start to damage the nerves in our hands and our feet. Your feet, you notice more in your feet. So that's where someone might complain of a burning, tingling, numbness sensation in the feet. So kind of like when you cross your leg and your foot falls asleep, but as soon as you uncross your leg and shake it out, that tends to go away. You have neuropathy, that tingly feeling tends to not go away. So it's kind of always there. You can also lose that protective sensation on the bottom of the feet. So people with neuropathy, if they were just walking around with bare feet and they were to step on something like rock, piece of glass, they might not notice that they've stepped on it. That can be dangerous because if it ever got embedded in the foot or if there's a cut on the foot, you don't notice it, it could get infected. So I always recommend to people to, if you do have diabetes, get in a habit of checking your feet, so checking your feet on a daily basis. If you can't actually look at the bottom of your feet, you can use a mirror to look at the bottom of the feet, making sure there's nothing out of the ordinary there. So no cuts or scrapes or anything like that that's not healing. No redness in areas, soreness, or things like that. Doesn't take very long to do a quick check, just to make sure everything is normal for you. If you ever notice that something's out of the ordinary on your feet, good idea to get that checked out as soon as possible so that if it needs treatment, that can be started right away so it doesn't lead to infection or anything. Yeah. Overwork the kidney. Oh, so when your blood sugar levels are high, your body doesn't like having that high blood sugar level. So what the kidneys will do is they'll try to filter out that excess sugar. So they'll make the pee out that extra sugar, which in turn can cause damage because there's so much sugar in such an area. So diabetes and cardiovascular disease. So as I mentioned, high blood sugar levels can do damage to our heart. So a lot of deaths are attributed to high blood sugar levels related to cardiovascular disease. That A1C that I talked about, so for every 1% increase in that A1C, really increases that risk of developing cardiovascular disease. And then for every 10 years living with diabetes, again, it increases our risk of developing cardiovascular disease. So I've talked about a lot of the complications related to blood sugar levels. So now I'm going to start to talk about what can I do to reduce my risk of developing any of those complications. So education is very important. So you guys are already taking the first step. Coming to education classes like this can really help to better understand your diabetes. Even if you don't have a diagnosis of diabetes, it's a good idea to learn. You might have a family member, friend, or learn ways that you can reduce your risk of developing diabetes. So understanding what it is, if you do have a diagnosis of diabetes, understanding what works for you to manage your diabetes. We do have recommendations and guidelines that we always educate with people, but what might work for you might not work for somebody else. So good idea to understand and know how to manage your diabetes. Nutrition, so focusing on healthy eating. So I'm going to talk a little bit about this, but it's always a good idea to see a registered dietitian for counseling and more education on if you have diabetes. There are a lot of community programs that focus on diabetes education that do have registered dietitians with some family doctors have their own team. I know in Cambridge, at Langs, they do have a diabetes program. Physical activity. So physical activity, it's very important for our overall health, not just for people with diabetes, but for everybody. It can really help with reducing our blood sugar levels, reducing risk of cardiovascular disease. So for physical activity, we're aiming for about 150 minutes per week. Okay, so that's about 30 minutes, 5 days a week. And then resistant activity. So when I say resistant activity, that's using resistant bands, weights, your own body weight to help with building muscle. So muscle's really good at burning sugar. So if we're working on that, it's going to help with reducing our blood sugar level. Weight loss, so we're aiming for a weight loss of about 5 to 10% of our initial body weight to help with lowering those blood sugar levels. Hypoglycemia, so this is for people that do have a diagnosis of diabetes, and if you're on certain medications that increase your risk of hypoglycemia. So hypoglycemia is low blood sugar. Okay, so some medications that you might be prescribed. So if you're using, for example, insulin to manage your diabetes, if you're using a medication called glyburide, dimicron, those medications can increase your risk of low blood sugar levels. Typically, when you would go to your pharmacy, they would let you know that this medication increases your risk. And then they would let you know, this is what you need to look out for, and this is what you need to do. Self-monitoring your blood sugar levels. So this is going to depend on where your treatment is. Not everybody, when they have a diagnosis of diabetes, needs to start monitoring their blood sugar levels at home. It's going to depend, like I said, on your treatment. So for certain people, if you were using insulin, we would definitely want you to start monitoring your blood sugar levels. If you're just kind of starting out with diabetes, you're not prescribed any medication, we don't always recommend monitoring your blood sugar levels right away, but it is a good tool to use to see how different foods, activities impact those blood sugar levels. Foot care, so I talked about foot care, so getting in the habit of inspecting those feet on a daily basis. And then mental health, so people who do have a diagnosis of diabetes are at a higher risk of experiencing anxiety and depression. So it's always a good idea if you're feeling anxious or you're feeling depressed, speak with your healthcare provider because you want to make sure that you are getting help with your mental health as well. And then smoking. So if you currently do smoke, it's a good idea to work on quitting smoking. That's going to help your overall health, not just diabetes, but your overall. So this is just continuing with what I can do to reduce my risk of complications. So we call these our A, B, C, D, E, S, S's of diabetes. So A is for that A1C. So for most people, we're aiming for an A1C of 7% or less. Okay. Sometimes we may change that to say 6.5% or less, but it's going to depend on your treatment. So you would work with your healthcare provider to know what's a good goal for you. Blood pressure. So for people with diabetes, we aim for a blood pressure of 130/80 or less. If you do already have some cardiovascular disease, you might even aim for a lower blood pressure. Cholesterol. So for people with diabetes, we're going to aim for that LDL of 2 or less. Again, if you also have some cardiovascular issues, you might likely aim even lower for that level. D, so drugs to protect our heart. So there's blood pressure medications. Okay, so we call those our ACEs, our ARBs. Sometimes people may be prescribed baby aspirin. Typically, if you have some cardiovascular disease, you may be prescribed that. There are some medications that help not only with lowering blood sugar level, but also have a cardiovascular protective property to them. So we call those our SGLT2s and the GLP-1s. They've been known to help with reducing the risk of cardiovascular disease as well, and also lowering our blood sugar level. Exercise, so I mentioned working on increasing how active we are, so aiming for that 150 minutes of activity a week. Screening, so screening for our complications. So if you have diabetes, it is recommended every 3 to 5 years to get an ECG. However, if you do have cardiovascular issues, we do them more frequently here, so it'd be more often than that, 3 to 5 years. For your feet, not only is it important for you to be doing your daily inspections on your feet, but also at least once a year, having your healthcare provider take a look at your feet. They're going to do something called a monofilament test. So what they'll do is they'll take this little plastic, flexible plastic, and they'll poke the bottoms of your feet with it. And you're going to tell them if you're able to feel it. Okay, so that's checking to make sure that you still have that feeling and sensation in the bottom of your feet. Kidneys, so I mentioned getting that kidney test, so that urine test at least once a year to check for protein in the urine, and then our eye exams at least once a year as well. Smoking, so if you, like I mentioned, do smoke, working on a goal of quitting smoking or really reducing how much you are smoking. And then, so self-management, so managing our stress levels. So stress can actually cause our blood sugar levels to increase. So if we notice we're under a lot of stress, we're constantly stressed, it can cause our blood sugar levels to be higher. Okay, so working on our stress, learning ways that help you to cope with your stress. So everybody is different with that. Sometimes people find going for a walk, doing some yoga, meditation, reading a book can be helpful with reducing stress. So whatever works for you with reducing those stress levels is really important with that management. So for those of you that are checking your blood sugar levels at home, this here just shows what blood sugar levels you should be aiming for. So as I mentioned, that A1C, so you get that as a blood test about every 3 to 4 months. So for most people, we're aiming for that 7% or less. If you're checking your fasting blood sugar at home, so that's that first thing in the morning when you wake up before you eat anything, aiming for blood sugars between 4 up to 7. If you're going to check your blood sugar after a meal, maybe you're curious about how that meal affected your blood sugar levels. It's a good idea to wait to that 2-hour mark. That 2-hour mark for anybody, even if you have diabetes or not, it's always going to be where our blood sugar levels are going to be that highest, and then they'll start to come down. So for 2 hours after you've eaten, aiming for anywhere from 5 up to 10. For some people, we might say 5 up to 8, and that is typically for people who are not meeting that A1C target of 7%. So this chart here shows some symptoms of high blood sugars and low blood sugar. So as I mentioned, that hypoglycemia or low blood sugar. So this is typically more common in people who are on those medications that can increase your risk of low blood sugars. So sometimes people might feel shaky, dizzy, sweaty, just might feel like something is off. If you're feeling these and you have your blood sugar monitor with you, always a good idea to check your blood sugar because you want to see where it is. If you're feeling some of these symptoms though, and you don't have your blood sugar monitor with you, always treat it as a low blood sugar. Always a good idea to err on the side of caution. So you would want to treat it. And when I say treat it, you want to treat it with some fast acting sugar. So typically people would use some juice, candies, so the lifesavers. There's things out there called glucose tablets, or Dex4 is common. So something that's just pure sugar. A lot of times people will say, oh, I have chocolate or I eat something. Yes, that might have sugar in it, but it also has other things in it. Protein. Fat and protein slow how fast sugar gets into our body. So those aren't the best ways, like chocolates, candies, cakes are not the best ways to treat low blood sugar because it's going to take longer for your blood sugar level to go up. So if your blood sugar is actually low, that's when you want just pure sugar. High blood sugar, hyperglycemia, a lot of the symptoms for that can also be the same as what a low blood sugar is. So that's why I always recommend, if you have your meter with you, check your meter, check with your meter to check your blood sugar level. But if you don't, just treat it as a low blood sugar because you don't want to have your blood sugar going too low. If you don't have a diagnosis of diabetes, but you are having some of those high blood sugar symptoms, good idea to follow up with that with your family doctor so you can get some blood tests done just to check and make sure your blood sugars aren't. Driving safe. So again, this is for people with diabetes that are taking insulin or medications that can cause your blood sugar levels to go low. So we would never want anyone to get behind a wheel if their blood sugar is below 4. So anything below 4 in a blood sugar level and you're on these medications, that's what we consider a low blood sugar. Because low blood sugar means you don't have enough sugar in your body. Your brain's not getting enough sugar. So if you were to get behind a wheel, it can really impair your judgment when it's driving. So it's not safe for you, also not safe for anybody else on the road. So if you are taking insulin or medications that cause your blood sugar to potentially drop, get in the habit of checking your blood sugar before you get behind the wheel because you want to make sure you're starting at a good level. Those of you that are in cardiac rehab, I know they always get you to check your blood sugar levels before you go home because they want to make sure that you're at a good level. If you check your level and it's low, make sure you're treating that low blood sugar before you even start driving. And it can take a little while for your blood sugar levels to come back above that 4. You want to make sure that you've given yourself enough time to recover from that low blood sugar level before you get behind the wheel. So sick day management. So this is for people with and without diabetes if you're on these medications. So if you're having vomiting, diarrhea, where you're not able to keep food or fluids down, these medications here, we want you to hold them. We don't want you to take them until you're able to start to eat and drink normally. If you are having vomiting, diarrhea, that increases your risk of dehydration. If you were to take these types of medications, that can further increase your risk of dehydration. Okay, so while you're recovering from that vomiting, diarrhea, hold these medications until you can start to keep those fluids down. So those are things called sulfonylureas, our ACE inhibitors, any types of diuretics, so like furosemide, those kinds of things we definitely want to hold. Metformin, so that's that diabetes medication, you're going to want to hold that. Another diabetes medication would be our SGLT2, so that's like Jardiance, Forxiga, Invokana. Wouldn't want to take any NSAIDs, so that's like Advil, ibuprofen, and then also our angiotensin receptor blockers, that's another blood pressure type of medication. So these we're going to hold until we can start to keep fluids down. So I'm just going to talk a little bit about healthy eating just to get everyone started here. So healthy eating, we call this our healthy plate model. So ideally, half of our plate, we're going to have with fruits and vegetables. So for those of you that do have a diagnosis of diabetes, we do know that eating too much fruit can increase our blood sugar level. Okay, so we do want to be aware if you have diabetes, how much fruit you're having. Typically with fruit, it's about 3 pieces of fruit per day. So for people with diabetes, 3 pieces of fruit per day. So that could be like an apple, a banana, orange, so per day. Yeah, a big apple. Yeah, usually it's about 3. I know. Yeah, a lot of the fruit nowadays is very large. Same with the bananas, can be almost like 3 bananas. Yeah, yeah. So just watching, yeah, how much. Yeah, yeah, they've gotten quite big. Same with like grapes. Grapes used to be pretty small. Now I find they're like 2-3 times the size. So when I say 3 pieces of fruit, yeah, just watching the size of it. The other quarter of our plate, that's where we're going to put a source of protein. So whether that's meat, fish, tofu, beans, lentils, those kinds of foods have really good sources of protein in them.
There's pork and beef, right?
Yes.
And we know that pork and beef, that lot of sugar. I don't know if it's okay to stuff like that. No, there's a lot of stuff in,
Yeah.
because of the sugar.
Yeah. So those of you on Zoom, there was a question about pork and beans. Is it okay to have? So pork and beans, yes, does have a lot of sugar in it. So it would be better to get, when I say beans, like beans that don't have added sauces to them.
Drain it.
Or drain it, rinse it. Yeah, and you're always gonna also want to choose like beans that don't have added salt to them as well.
Make your own.
If you make your own, yes. Always, if you can get in the habit of making your own things, it's always good. You can control what you're putting into it. So when I say beans for a source of protein, I'm talking like kidney beans, black beans, chickpeas that don't have any added sauces or salt to them. The other quarter of our plate, that's where we're gonna put our whole grains. So like whole grain bread, whole grain rice, whole grain pasta, those kinds of things.
What whole grain bread?
Yes, whole grain bread would be good.
Yeah. So how much of tomato are you gonna have to eat it? Just tomato that they're sweet.
Yeah, tomatoes though would be in that vegetable just because you have to eat quite a bit in order for you to really notice an impact. Yeah. So even the same, a lot of times I get questions about carrot, because everyone knows carrots do have sugar in them. Yes, however, you do have to eat quite a bit of it. Most people aren't going to eat that many carrots that way they would notice too much of an impact on blood sugar.
The seafood.
So seafood's really good. That would be in that protein.
Thing is, you know, the fat.
Yep.
Like, and salt. Once salt, it tastes it different. Iron.
Yeah.
Thing is, it tastes salt.
Oh, yeah, yeah.
So,
Yeah.
not if they're good for them.
No, that would be fine. Yeah. When I talk about salt, when I talk about salt, it's if you have high blood pressure, cardiovascular diseases, you don't want to be having too much salt.
Yeah, but even though you don't.
Yeah,
they
it's
still
it's
very
yeah.
salt, right? So,
Yeah. Another way to remember serving sizes of foods. So we call this our handy portion guide. So this is per meal. So we're talking about 3 meals per day, not just 1 meal. So when we're looking at our fruits, our grains, our starches, so about the size of your fist would be considered 1 serving. Okay, so we mentioned how apples can sometimes be 2 servings. So you're going to want to choose, say, an apple that's about the size of your fist. That would be about 1 serving.
even though how big you are.
Yes, that's why you go with your own fist. So use your own fist because that's, yeah. So if you got a small fist, then you're going to be having smaller stuff. But it's a good, easy way to remember things. So per meal, you want to be choosing about 2 fists of those grains and starches and fruit. Okay. Vegetables, so vegetables as much as 2 hands can carry. Meats, we're looking about the size of our palm and then the thickness of our baby finger. Okay, and then our fats are about the tip of our thumb. And this, again, remember, per meal. So our 3 meals per day, not for the whole day. Yeah. If you are a milk drinker, don't feel like you have to drink milk. Water is perfectly fine. Some people do like milk. You can add that as well. So about 1 cup, 250 mils, 8 ounces. You could have that 2 to 3 times a day. What?
2%. 1%. Oh.
Yeah, typically we recommend if you can do the lower milk is what we would say. Exercise and diabetes. So this is just a little thing you can think of to help with getting you more active during the day. So a lot of our jobs nowadays we're sitting a lot during the day. And so if you can get up, move around for at least half of the day, can be really good just to move our muscles and help with blood flow. Standing, so you want to try to stand every 30 to 45 minutes throughout the day, kind of do a little bit of stretching, move your muscles around. Walking, so walking, we're aiming for about 10,000 steps a day. So this can really help with, it's really good for our mental health, really good for our overall. Is the more we're able to walk around, better it is overall. Light activity, so as much as you can do during the day. So on top of that walking, that would be like household chores, gardening, those kinds of things, light activities like that. And then that moderate intense activity. So that's where you're getting that heart rate up more, aiming for that 150 minutes a week. This website here, so Diabetes Canada, is a really good resource if you want more information on diabetes. So this is where, as a diabetes educator, we get all of our recommendation and guidelines from. It's all backed by research and science. So this is the website I recommend if you want more information. They do have a lot of good tools on there. So if you're looking for strategies for increasing your physical activity, if you're new to, say, resistant activity, they have a lot of good information on there. They have a lot of good recipes on there for people with diabetes. So really good resource to use. So it's Diabetes Canada website. And then I really like this quote here by Albert Einstein. So if you want to live a happy life, tie it to a goal, not to people or objects. So with that, I just like to just go over, so we call these our SMART goals. So setting goals for ourselves, things we would like to work on. Doesn't have to be diabetes related, can be overall like general health related. So setting goals that are so specific to what you would like to achieve. Measurable, we want to be able to measure how well our progress is with achieving our goals. Achievable, so we want to make our goals achievable. I wouldn't want to say I want to run 5 kilometers when I've never run anything in my entire life. Okay, really not an achievable goal unless I'm creating a strategy to work towards it. We want to make these goals realistic. So we want to set a timeline for us that we're going to be able to work towards, and that it's not going to start to discourage us from achieving that goal. Timely. So for some people, maybe they want to work on increasing their physical activity. So this is just an example here of what the action plan might be. So what is the change you would like to happen? Maybe your change is, I'd like to walk. How long is it going to take you to reach this goal? Are you going to give yourself a month to maybe walk 1 kilometer, 2 months, 3 months? What is your action plans? What are you going to do that's specific to help with you achieving that goal? So if you want to increase your walking, when are you going to do it? Where are you going to do it? How often are you going to do this? Think about things that can get in the way of you achieving your goal. So maybe every Monday you've decided at 9 a.m. I'm going to start with a 10-minute walk. Well, maybe that Monday it's raining, so you can't do that. So what can I do to continue with my goal, but have a plan that if something like that happens, I can maybe change the date, change the time, so I can still achieve that goal that I've set. What are some supports and resources that you need? Is there any family member or friend that maybe can help you with achieving your goal? How important is this goal for you? So this is a really important thing for you to think about. If you set a goal for yourself that you're just like, I'll do it when I can, not gonna work on achieving that. Okay. Then how confident are you on a scale of 0 to 10 that you'll be able to achieve this? Remember, goals can always change. So if you found, hey, this is a pretty easy goal for me, you can make it more challenging for yourself. If you find you've made it too challenging for yourself, then you can scale it back. Goals are always changing. So just in summary, so for managing diabetes, we want to work on improving our diet. So focusing on that healthy eating, getting our regular physical activity and achieving that healthy weight, taking medications if you are prescribed them to help with blood sugar management, and then self-management through our lifestyle can all help with achieving a normal blood sugar level. So that is it for the lecture part of this. So